This short training video shows how to use the Radar Model 4150 vascular compression device. Indicated for use by medical professionals to promote hemostasis at a puncture site, Radar has no latex and has the following components: a strap, which is adjusted around the patient's wrist, a housing that the strap passes through, a housing pad which cushions the radius during deployment, a movable floating pad, which can be adjusted to fit virtually any size of patient wrist and cushions the ulna during deployment, a movable compression pad, which is placed directly over the puncture site during deployment. Note that the compression pad has a groove that should be placed over the sheath during deployment, as well as bleed holes to help show if any bleeding from the puncture site occurs. The dial is turned by the user to tighten or loosen Radar during deployment on the patient's wrist. Before deploying Radar, be sure to dry the puncture site area and the operator's gloves. Pull the hub of the sheath so that the sheath is exposed. Note that Radar's housing will be on the radial side of the wrist with the dial facing up. Thread the tip of the strap under the wrist and through the housing. Pull the strap so that Radar is loose around the patient's wrist. Place the compression pad so that the sheath is directly under the groove. This ensures that compression is directly over the radial artery. Note that the puncture site should be under the area of the front bleed hole. Any bleeding can be seen through the compression pad and also when blood comes up through this bleed hole. Ensure that the housing pad is against the radius and that the adjustable floating pad is against the ulna. Tighten the strap so that Radar is snug around the wrist but not applying occlusive pressure. This can be done by grabbing the strap with your fingers and pushing with your thumb against the dial. Check to ensure proper placement of the housing pad, floating pad, and compression pad. Be sure the sheath is directly under the groove and the puncture site is under the area of the front bleed hole. You are now ready to remove the sheath and apply compression. After ensuring proper positioning of Radar, you may aspirate through the sheath sidearm if your protocol indicates this. Then place your thumb over the compression pad. Apply occlusive pressure with your thumb, then pull the sheath out. There should be no bleeding. If your protocol indicates, flash the site. Immediately tighten Radar to match the occlusive pressure applied by your thumb by pulling on the strap or by turning the dial clockwise to the right. You may then remove your thumb. There should be no bleeding from the puncture site and the distal radial pulse should be absent. Wick away the blood in the compression pad, if there is any, with the tip of a 4x4. You are now ready to achieve patent hemostasis with Radar. Palpate the distal radial pulse, which should be absent. To achieve patent hemostasis, immediately loosen Radar by turning the dial counterclockwise to the left until the radial pulse returns. There should be no bleeding from the puncture site. Confirm patent hemostasis and dry puncture site and ensure that Radar is firmly secured around the patient's wrist. You may then tuck in the strap. Hold Radar in place with your other hand. Tuck the tip of the strap through the loops of the compression pad to keep it out of the way. Advise the patient not to move their hand during the hemostasis period. Radar lets you easily adjust compression during the hemostasis period. When the patient is transferred to a recovery area, check to ensure a dry puncture site as well as continued patent hemostasis by palpating the distal radial pulse. Compression adjustments may be made every 30 to 60 minutes or as indicated by institutional protocol during the hemostasis period. To adjust compression, loosen Radar by twisting the dial counterclockwise to the left by no more than 1/8 of a turn. This permits gradually increasing distal blood flow through the radial artery. Ensure there is no bleeding at the puncture site. If a rebleed occurs, tighten Radar by twisting the dial clockwise to the right, then ensure continued patent hemostasis and a dry puncture site. Wait another 30 to 60 minutes before loosening. Total compression time may vary between 1 and 3 hours, depending on anticoagulation, sheath size, and patient condition. When hemostasis is complete, you may remove Radar from the patient's wrist. Hold your thumb lightly over the compression pad without pressing down, and slowly loosen radar by twisting the dial counterclockwise to the left to gradually remove any remaining compression. Observe the puncture site for rebleeds while loosening. Palpate gently around the puncture site to help separate the compression pad from the skin and continue to loosen radar. You may continue to twist the dial counterclockwise until you are able to slide radar off of the patient's wrist. If there is a rebleed, press down with your thumb and retighten radar. Alternatively, you may use the quick release feature. Pinch the shaft of the dial between index finger and thumb. Then press with your middle finger against the tab to firmly pull the dial away from the housing. This releases the strap so it can be pulled free. Another quick release method is to pinch the shaft of the dial between index finger and thumb, press with the middle finger against the tab to firmly pull the dial to release the strap. Then gently hold the patient's hand in place and pull up to remove radar from the patient's wrist. Radar should be disposed of using institutional bloodborne hazard protocol. Thank you for watching this training video of the RadAR Model 4150 vascular compression device. Refer to the user's manual for further details.